Welcome. My name is Corinne Waldau. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the April 8th edition of the Boulder County Public Health Updates for Industry. I think we're coming up on our 1 year of doing these. I think it was April 30th that we did our first one last year, Lane. So we're we're getting close to that 1 year anniversary of doing these sessions, but we continue to hear that they're valuable updates along with the emails, and things keep changing. So, we know that there will be changes coming up in the near future, but we will do the best we can to update people on mask order changes. I know there's questions about that. We will update on what you know about future changes to the dial, current changes to the dial, vaccinations, any questions that come up. I know that people have some questions about some of the CDC clarifications, so I will bring those up after you get through your presentations. So we'll just start off with Lane Drager from Boulder County Public Health.
Thank you, Corinne, and thank you all for joining. We'll go through a similar agenda to what we've done in past weeks with the EPI update, talk about kind of where things are at, dial, and some of the projections. I don't have definitive answers, but I will share to the best of my knowledge what I think may be happening in the next several weeks and over the next month. Talk a little bit about FiveStar and have plenty of time for questions and answers for all of you. So our trend has unfortunately been consistent, that we are very solidly in yellow. There's a little bit of a change from when I first started making these slides to when I looked just recently. We were at 172.7 and now we're at 166. So kind of the first time that our case counts have dropped for several weeks. So that trend hopefully is starting to reverse, but this is still a significant jump from where we were a week ago. We were at 132 last week. So again, that trend has been continued to be concerning for not just Boulder County, but for the metro area. Similarly with positivity rates, as it continued to climb, this is at 5.3 where it has been this week, earlier the week, and then as of today still, and it was at 4.2 last week. So again, trending in the wrong direction with both the last two metrics. Hospitalizations, fairly stable. This seems to fluctuate between 7 and 11 days, but has not dipped below that. So that is still a good sign. And here's that epi curve kind of since the beginning. And you can see the last several weeks, we've had this upward trend and then a really significant spike most recently. So very concerning that we're seeing this and likely seeing some spikes from spring break and then just general mobility where people are definitely a lot more active now. Again, you see that spike from where we were from the previous report. Similar breakdown though from last week, but again, the numbers are just much higher, but 26% of the cases in Longmont, 46 in City of Boulder. The total breakdown, City of Boulder had 260 cases, Longmont 155, Lafayette, Louisville, and Superior 75 cases. And then our other municipalities and unincorporated Boulder County were 71 cases. Still tracking our disparities within the Hispanic and Latinx community. So those are still prevalent. I think we've shared in the last several weeks, certainly from previous months, that trend has diminished. So we are not seeing the same level of disparity, which is positive. So that has been reduced from where it was in February. So hopefully again, that is another trend that's going in the right direction. But you can see that spike that we had that still bore out across all of our demographics for the spike that we've seen. This is what I've mentioned is one of our causes for the spikes is significant activity within our community. So again, the measurement of social distancing, how much time people are spending outside of their homes has increased dramatically. So we're seeing those percentages of social distancing shrink. So where we've been for the previous weeks, we were at 28% last week and 65 a few weeks ago, and we're down to 16%. So again, we're seeing a lot more activity, a lot more risk for transmission, and that is bearing out in in actual cases. So fighting those two fronts of more activity, more cases, as we're feverishly trying to get more and more people vaccinated. So here's where we're at on the vaccination front for Boulder residents, Boulder County residents. We're at about 120, just over 127,000 people have received either a single or a full course of vaccines. So, so again, continuing to work on that. There's been a pretty good jump in the number of vaccines that have been delivered as well. So I'll give you further count on that in a future slide. But here's where we're at with some of our specific target age demographics. Still very high percentage of our 70 plus, which is again helping with our a little more stabilizing that hospitalization metric, as those are higher risk populations. And again, over 77% of that 60 to 69 and over 55% for the 50 plus. But within those age demographics, we're still seeing disparities for our persons of color and our specific population. So you can see the percent of white folks that are 70 plus, we're seeing 88.3% vaccinated, whereas our BIPOC population is 68.6. So it's a pretty significant drop off. And again, this is the concern we have, which is also bearing out in some disparities with disease that are bearing out. But we really want to target that with our clinics that we're doing at Boulder County. Those are going to be very much targeted to our disparity in vaccination. We're also tracking across the county those areas where we're seeing lower vaccinations. So this is now, we've been moving this age demographic down over the last several weeks, started initially with our 70 plus, then 60 plus, and now 50 plus, and then also looking at 16 plus now that we're looking at our whole population who's eligible. So here's, again, areas that are lighter in color have lower vaccination rates. So again, we will be looking at those and again, targeting some of our vaccination communications as well as our vaccination clinic efforts. So last Friday, we talked about phase 2 being open for all of Colorado residents. And then luckily, we did see a significant increase in how many vaccines we received and were able to provide. So it was almost 19,000 last week compared to 8,500 the week before. So that is a good trend that we hope continues, that we keep seeing increases in vaccine, as we know we have the entire population now eligible for that vaccination. Here's again the resources for the state. I know Corinne has been sharing these for several weeks now, but still want to make sure folks know about the state website and the state call center number, where you can get a lot of those questions answered related to vaccine. They also have all of the clinic sites and provider sites across each county. We have that provided on our Boulder County site, but at the state site, if you're in another county, you can see those providers within the county that you're looking for. So again, just those key takeaways, we're still seeing rising case numbers, continuing to move further into that yellow dial status. We were on average, our cases in the past week increased to 82 per day. So again, that's another big jump. So we are concerned about all of that. Our case rates are increasing for most of our age demographics that we've been looking at. Sort of the one exception is our 65 plus, which is what we would expect since they have a very high vaccination rate at this point. So again, just showing that diseases across all of our age sectors, especially the ones that have not been vaccinated, because we're seeing high mobility pretty much across all those same age demographics. Again, still seeing and tracking those disparities within our Hispanic Latinx community. That trend has gotten a little bit better, but it's still something that we're still concerned and tracking over. Over 45%, so that looking at that 127,000 of our eligible residents have received at least a single vaccination. So again, that's great. We're starting to get closer and closer to our goals of herd immunity, but still have a ways to go. Those higher age demographics, as we shown, have very high vaccination rates. So that is, again, a very good sign. We are, as I showed, also those disparities within those age demographics still exist. So that's another, again, target that we really need to work on. And then obviously our testing, the numbers I think have come up a little bit, which is good, but our positivity rate continues to elevate and continues to trend in the wrong direction. And again, the likeliest cause of that is people are out and not taking as much precautions and having a lot more exposures within the community. So the biggest update we have related to our local orders is our Boulder County mask order was updated for 1 month, and it had a significant revision in that it no longer requires masks outdoors. We still very much encourage any of the settings where you were wearing masks. We still want people to do that, but it is no longer a mandate. So, so that's the most significant change. All of the indoor applications are still in effect. So you do need to wear masks indoors in all settings that you did before. So there's only a few exceptions where you would not need to wear a mask indoors. FiveStar program, just latest audits, that was up to 68 total audits, 60 businesses certified. So not a lot of activity just because of, I think, the businesses who saw the advantage have jumped into it, but I think there's just some hesitancy there within the community of what the next steps are. But Corinne, any other things you want to share on FiveStar?
No, but just stay tuned. There could be some just shifts as the orders shift. We could be shifting the program, but the infrastructure will be in place, and FiveStar is not going away. So.
And I think the other update I wanted to share related to dials is we're expecting that there'll be a shift at the state level in the next week, likely at the end of next week. So the Metro Denver partners, which is all the health departments within the Metro Denver area, have been discussing if the dial is removed at the state level, what should go in its place at the local level. So basically the governor is turning over the regulation of the COVID response to each of the local public health agencies. So the Metro Denver intends to be consistent and have as much as possible a very consistent approach. So I think the projection is that the dial will stay for another month, but some of the counties might be moved by the state into a higher level, which means we might be moved into blue, even though our metrics have been moving further and further into yellow. So we don't know this yet at this point, so we're waiting to kind of see what the governor's decision is, but we are expecting a local order will go in. It will not be more restrictive than where you're at now, but likely something consistent with what you are experiencing. And then there is a possibility of it moving to be less restrictive if we're moved into a blue dial status. And as a county, we feel that that makes sense, which again, that the trend unfortunately has been very unfavorable. So we'll see if that is the decision. But just to give you as much forecasting as I can, as we've always been uncertain on what the order changes will be for a year now, and we're not a whole lot different, unfortunately, but that's kind of what we're starting to work and plan on based on what happens next week. So still don't have a definitive on what actions the state is intending to take.
Well, in case increases matter, I read today that Jeffco, as of Friday morning, will be going back to yellow, even though they were in blue, because their case counts have gone up. So.
And I think they actually already did move back to yellow. So it is a challenge. And again, we're seeing that across. It's partly because of more mobility, but the variant strains that are out there are causing more disease. So they end up causing more people to get sick. Much higher percentage of people that are exposed end up getting sick. Not necessarily hospitalized deaths that level, but it is causing more illness. So that's, again, the concern is that these variant strains, and we still don't have enough folks vaccinated, that if we further relax things, we keep trying to potentially tip the scales. And the more we allow the virus to mutate, the more concern we have that we will get a strain that our vaccines will not be effective against. So all this effort that we've gone through for a year would be for naught if our vaccines are no longer effective.
For those people that missed last week, we had a special guest, an epidemiologist on, who talked about the different variants. And this was prior to the discovery of the additional variant that was discovered in Boulder County. But The recording was sent out today. If you want to listen to it about how contagious some of these variants are, extra measures, the quarantine, all of those pieces that you need to take into account as a business with these new variants, explaining the variants, the testing procedures, where you get tested for these variants, that only two sites in Boulder County actually test for the variants, and those are the Mako sites, the sites at the fairgrounds and at Stasio. So if you're interested in learning more about the variants and from the epidemiologist that attended last week, please watch last week's recording. It was pretty fascinating. Also knowing that in most cases of the variant, you are symptomatic. So that is very, it was a pretty fascinating presentation, and something we don't get very often, which is to have an epidemiologist on. So we pounded over some really good questions. So.
And so again, this tool that we've been talking about that maybe people have been less likely to subscribe to is even more important now that we are seeing these variant strains become the more predominant strains, and they are causing a lot more disease. So this is still a really important tool to help us get early identification of folks that may be at risk, so that we can, again, stop the spread. And as I'm sure many of you know, but if you are new to the call, this is our regular time slot to give updates on what's happening. And then we have not used the Friday time slot and don't have intent to use it this week, but certainly if there's a significant issue, we have time blocked out to try to pull folks together to share that information. And then our Spanish language session is pre-recorded and released on Thursdays. And all of the pre-recordings are available on the Chamber's website. And I would encourage folks to go back and review any of that. And lastly, our resources. So to reach our business team, this is the email address for our business team. And then the call center, which has been a big resource to get people connected to providers for vaccine. That's the call center number and hours of operation. And happy to move into questions.
Some people joined late. Could you go through the three metrics one more time? The case count per 100,000, the positivity rate, and the hospitalizations real quick?
Yeah, we're solidly in yellow in pretty much all of those metrics. As a county, we are still in the yellow dial status, but this 172 is where we were as of Tuesday, and as of today, we did finally see a little bit of a drop, but that 166 is still, we were at 132 last week, and we were at, I think, 127 the week before that, or, so we've been trending up for the last month or almost 2 months. And then positivity also, same thing, upward trend. We were at 4.2 last week, and we're at 5.3 this week. So the only reason we're still in yellow is the state changed that metric to, I think now it's below 7 is keeps you in, or actually it was was it 7.5 keeps you in yellow. So it was, I think we were at 5, or no, actually 5 is the cutoff to go to blue. So anyway, we're at we're moving further and further into yellow, where we had been blue for a very long time in positivity. And then hospitalization status is fairly stable. We have not see the same level of fluctuations, and again, that's likely because of getting a lot of our higher risk populations vaccinated. And again, here's that overall trend of where we're at. You can see at the end of this graph, everything has just been moving up, and unfortunately I've seen a very big jump in the last week.
So as far as the vaccinations, you mentioned the percentage of Boulder County residents have been vaccinated. Does it count if you got your vaccination in another county? How is that factored in?
Yeah, as far as I know, that the address that you provided is what links you back to being a Boulder County resident, so where you live. So if you got vaccinated in another provider outside of Boulder County, that still would be part of our records. Similarly, with if you were identified as a case outside of Boulder County, it goes back to the residents of where you live.
Okay. As far as the variants go, I think I put into the chat the epidemiological presentation, and she clearly identified the different variants. And then there was the news story, I think it was yesterday or the day before, about the additional variant that was 2 cases were identified, and they were identified in Boulder County. There was a question about that. Any other news about any variants? I mean, the variants that have been identified. I mean, I think it's there in the presentation. I think there's variants in our community, and they're tracing them.
And when we know what we've identified is not, all inclusive. So we know that not everybody's getting tested still. Not everybody, if they're not going to the sites that are doing that variant testing, only a small percentage of tests then get screened for additional variant identification. So we know that there's much more than what has been reported. And again, folks have been incredibly mobile. We know that a lot of people traveled for spring break. Some people traveled here to be on spring break. So we know that people are moving the variants around our country and around the world very rapidly, which is how COVID got here in the first place. So again, that mobility is still very concerning, that there's a lot out there for people to still get.
And again, to be tested for the variant, you have to go to one of the MACO sites. So if you're tested positive, you have to be at either the fairgrounds or the Stasio, and only a percentage of the positive tests at those sites are then tested for a variant. According to last week's presentation, so not even every positive test is even tested for the variant, which is what you're trying to say.
I think it's the state as a whole is only screening a very small percentage of tests for variants. But I think those 2 sites, the MACO sites, are doing testing of all positives for variants.
Do you have any statistics about the number of people fully vaccinated past the 2-week period who test positive? So those breakthrough cases who test positive for COVID?
I don't have a percentage. It's fairly low, but it definitely has occurred. There have been cases in Boulder County where that's occurred, and definitely throughout Colorado. It's still not a high percentage, but it is. But it has happened, and it's not surprising when we have a vaccine that's 90-some%. That does mean potentially 10% will not get the same level of immunity. And when you multiply 10% times over 5 million people in Colorado, we're going to have that happen. So what we have not seen is anybody that's vaccinated has not developed severe illness to be hospitalized or had a fatal illness. So it has dramatically reduced illness for anybody that did have a breakthrough.
All right, let's talk a little bit about the confusion around the mask. I think when the governor on Friday night announced the change to the mask order, there was confusion that he had made changes to Boulder County, and that was not actually the true. He had made changes to the counties that were in green. He had actually not removed the mask order for Boulder County. The indoor mask order was still in place. What Boulder County did was then go and just amend your mask order, or Boulder County amended its mask order to remove the outdoor component of it and change it to the 1 month, a 1 month as opposed to an indefinite mask order. Now there's a lot of questions now that there's not the outdoor component. That's more of a recommended component piece. We have some restaurants or those businesses that have an outdoor and an indoor component asking, what if we have an outdoor and indoor component? Do we require masks? What is our policy at that point?
Well, again, when people are seated at the table and are eating and drinking, their masks are going to be removed. So for restaurants, what I would urge you is not to change anything at all. That as people put on a mask to go back in to use the bathroom, they shouldn't wait until they actually enter the building. Just put it on before they leave the table. Your staff who are going inside and outside should just keep their masks on, so they're avoiding taking them on and off. And the mask is a huge tool, so not using it is just an increase in risk. So that change is an agreement across the metro area in how people are going to start to try to move forward and really focus on indoor environments as where we know that there is a much greater risk, and try to give more incentive to people to taking activities outdoors. It does not mean that there's no risk, or now that there's no risk of transmission outdoors. It is the same risk. But again, we know that that indoor risk is much greater.
Now, what if you're a retailer? So you're a retailer that has an outdoor and indoor component. The question is specifically, should we require masks at all times anyways?
Again, staff, I think, that are going to be moving around being indoor and outdoor, it makes sense to just keep your mask on. But if you're taking a break outdoors and take your mask off, that was already okay. It was, again, as a break. But really, if you're talking about your patrons, I would encourage it. And it's up to you how much you want to require folks to wear masks. But we still encourage masks. They are an effective tool.
In the order, it says recommended when 6 foot distancing cannot be maintained.
Yeah, and
And
that's what the orders had before, is you didn't have to wear a mask outdoors if you could socially distance. It was when you couldn't. So again, instead of it being required, we're still encouraging that, because we know that that's still a prevention.
And under the state and Boulder County, indoor mask required. Whether you're 6 foot distanced or not, mask required.
Yeah, the state had some different nuances that are very confusing. It did allow counties in green to potentially petition to no longer have masks. So Boulder County doesn't have any of those caveats. So you don't have to dig in and try and figure out, well, if there's this many unvaccinated people that are part of the group, now people do have to have masks, and how would you identify that? So there's no conditions indoor, aside from somebody being alone, that you wouldn't have to wear a mask. So masks are required indoors at all times.
Okay. Currently, so that's the masking. And then just a reminder, City of Louisville also updated and amended their mask order, and I put that link into the email I sent out today. They do have a stricter age limit on their mask order, and it is a longer order. So please, if you are in the City of Louisville, check out the City of Louisville order. It is the strictest order of the 3, so you will need to check out the City of Louisville order, especially on the age component, because the other 2 are 10 plus. City of Louisville is still 2 plus. So please,
we still encourage those people that have young kids to still have a mask, especially 3 and up. It is just not a requirement.
Yeah. So I just wanted to point out that the City of Louisville one was amended, and I did add that to the email. It's just not highlighted at the top, but it is a link in there, and that was done this week. So we have some questions about what is blue, if we're in blue, if we're a restaurant, if we're 5-star, can we space our tables less than 6 feet apart at this time?
Not at this time. I don't know that that is part of the discussion for a significant change. I know that's been the biggest barrier for restaurants in capacity, but it's also the public health barrier for a disease. So once we take off masks and once we reduce 6 feet, we've lost the 2 major intervention strategies. So as of right now, that's not allowed, and I don't know that that will be the case, but we will definitely share next week. We should have a better idea of what the local orders are going to look like, and share that, because those will likely go into effect this next weekend into that next week.
So currently the blue is 100% capacity while maintaining 6 foot distancing, which we know you can't hit 100% capacity while maintaining 6 foot distancing. I do want to point out that I've heard, Longmont EDP, the other chambers, we've heard your feedback, some of the things that you need, and we have been submitting those feedback points to the local health departments. As if changes were to be made, these are suggestions. And so we have been submitting. I just want to point that out. We have heard, but again, the balance of health, the orders, those are all being taken into consideration, but that is one of them that's on the list. So I just wanted to point that out. 6 feet is required for outdoor dining though too, correct?
Yes, and I was just going to mention that I was on a call with many of the other counties that have 5-star programs with the state on kind of where they're intending to go with the 5-star programs, in addition to where things are at with the dial and potential future dials. So there is a lot of discussion on potentially having 5-stars either be pilots, or are there considerations to look at for 5-star certified businesses that would either give different allowances and incentives for folks to be 5-star. We're just not sure where that is going to end up. But those discussions have been going on and have shared the idea of being creative and looking at what are things that we could do, and especially for businesses that have already been very proactive at putting risk barriers in place.
Yeah, we've been very vocal about that. But again, at this time, we're trying to do the transition in the next couple weeks to, from the state to the local, and make it as seamless as possible, and still maintain some of the variances and the opportunities for 5-star businesses to operate at higher capacities. Okay, so clothing quarantine. So I think that we asked this question last week. I'm not sure if this is the same person or a different person. The clothing and soft goods quarantine time, has that changed? What's the best practice? What's the science on that right now still?
We haven't changed any of our recommendations, and that's what they have been. There's no orders that require any of that. So we've just encouraged that. We know that there is some risk there, but it is a much lower risk. This is not the main route of transmission where people are getting sick, but it is a possibility. So we haven't changed any of those. And again, with all the variants that we have out there, we certainly don't have any new information on that. It says the variants are less likely to be exposed that way, but we don't know the other side of it. Are they more likely to be an exposure route? So that's where I think we're just going to continue with our recommendations as they have been on what you should do for quarantining.
And that currently is in the I believe it's like that 3 to 7 day range. Is the website, it still has that cleaning of products. There's the link to the cleaning of products that we've been providing since the beginning, and I don't think anything has changed on that.
Yeah, I mean, where you can launder things, that's, I think, your ideal. If you cannot, that's where I think doing some level of quarantining is going to be an extra safeguard. So that's again, we know that there's different businesses have different challenges with maintaining the level of inventory that they would need to quarantine. So again, it is a recommendation based on your ability to do it.
Yeah, one of the things we did with the 5-stars, you have to remove all soft chairs and anything that's not able to be cleaned. So quarantine times. Let's talk about people quarantine, not individual or not goods. So let's talk about the quarantine of an individual who is partially vaccinated, who's exposed to a COVID positive household member. Is there a change in their quarantine time if they've only had one shot?
No, it would be fully vaccinated people. And then the one still caveat is if those exposures are to a variant, especially one that it may be of high concern, then it is a different answer. So again, there is some case specific answers that go with that, but for the most part, the only time you wouldn't need to quarantine is when you're fully vaccinated.
Okay, so the second part of the question was, so the first part was if you're partially vaccinated, you quarantine the full amount of time. If you're fully vaccinated, you don't need to quarantine unless potentially you've been exposed to a variant.
Yeah.
Okay.
And we know that there's still a very high efficacy for vaccines even before you get to the full dose. So again, it's still a good protective measure to even get that first one, but it is wise for people to still minimize their risks until they've had it, depending again which vaccine they're getting, get that full dose, and then that 14 days post getting that final dose.
So you talked about people moving around more, not distancing, not staying home as much. And one of the questions was, the increase in devices moving around. Is that partially due to the fact that our middle schoolers and high schoolers are now back in school 4 days a week? Could that be contributing to that increase?
Yeah, I mean, we've seen that age demographic go up. So, we're tracking multiple factors. So when we look at age demographics, so that age demographic has seen increases, but so has many other age demographics. Again, there's really only, I think, the older age demographic that did not see those increases. So so that is definitely a piece of it. We know that sports has been a huge contributor within those younger age demographics. I think 2/3 of the cases within, the school age kids have been a result of sports, teams, clubs, activity. So we knew that was a huge risk factor, and when the pushes were to allow a lot of those variances, it came with a lot of disease. So so it has continued to be a challenge. And again, knowing that those kids still are not eligible to be vaccinated.
Have the number of tests being administered in the county dropped? Even though our positivity rate's gone up, have we seen a drop in testing, or has it been about consistent?
We did see a drop, but we did see a rebound in that. So we had seen a little waning in the number of folks that were testing, but that did come back up in this last week. But that continues to be a concern, that people do need to get tested, especially when they're feeling those symptoms. As we know that these strains are more likely to make you sick. So if you are seeing those symptoms, there's a much stronger chance that you have COVID and that it's one of the strains that are now variants that we're concerned about.
Okay. The second part of the question is it possible that people aren't getting tested unless there's a possible exposure or symptoms, but we want them to get tested if they've been exposed or had symptoms. And then if you have symptoms, again, they test for the variants of those two Mako sites.
Yeah. And we definitely want people who are experiencing symptoms to be tested. If you are exposed, we want you to wait 7 days before getting tested, but still get tested. Or if you develop symptoms before then go in and get tested. But it does take a while after an exposure before you get sick. So, doing a test right away after you were around somebody that you found out was sick, you still could become sick later on. So again, that's the goal with waiting 7 days.
Okay. Now we're going to talk about cleaning supplies. So apparently the CDC has revised guidelines on cleaning surfaces, disinfectants for soap and water. There's the CDC approved hospital grade disinfectants, which are pretty expensive. Is it possible to, move towards, spraying down high touch surfaces with soap and water, using soap and water as opposed to some of these more expensive disinfectants?
Again, if you're required to do that, then that has not changed in the orders. But yes, for cleaning should be different than disinfecting. So cleaning is soap and water, and that's I think always something that's very important to do. Then when you are needing to disinfect high touch surfaces, that has not changed as of yet. So you still should use those other products.
So let's say you're a museum and you're trying to disinfect manipulatives that's touched by a lot of people. You should probably not just use soap and water. You should probably still use some of the disinfectants as opposed to just soap and water.
Yes.
Okay.
And again, it's really focused on high touch surfaces. This is not a thorough cleaning of every surface in a business or facility. So we're really looking at high touch surfaces. So it doesn't mean go through and clean your entire facility with all those chemicals.
Just those places that are touched a lot. And would you recommend cleaning between every person, or can you go and clean in shifts or between a group of people?
You're going to need to follow your sector specific. So like at a restaurant, they do need to clean the tables between dining parties. So that becomes sort of between every group. And then bathrooms are cleaned every hour. So it's not necessarily after every person has been in there and ever used. So really going back to the requirements that you've been under already. So there's no change or increase in frequency that's been added.
Would you recommend that a museum, for example, look at what like a childcare facility would do, or if they have manipulatives?
Yeah, depending on the age demographic that you're seeing come to your facility. I also would still encourage, if there's things that don't need to be touched, that you kind of stop that, at least until we're through the pandemic. So those are just smart actions that don't create cleaning situations if you don't need to.
Okay. And then we have a faith-based organization on, and there's a new recommendations for education settings that allow children to be 3 feet apart. Is there any way that you can have, for example, 10 children playing violin, not singing, wearing masks while performing, playing at a church, for example, on a platform 3 feet apart at this time?
I think that's a different application from the educational setting to the other, sort of more of a performance. But again, those are much better if they're still masked. That's a risk reduction there. But right now, we still want those folks to be 6 feet apart.
Okay. So at this time, even though the CDC, that's in the education setting, is allowing the 3 feet, under the performance, under some of these other venues, it's still 6 feet, even if you have a little marker on your floor that keeps them 3 feet apart.
Yeah, the concession for the education is to make sure we have kids in classes so that there's not the challenge of how they try to manage those volumes, as well as the fact that they're doing a lot of other cohorting and other factors that applying that to every setting, it doesn't have the same safeguards.
Yeah. So it's specific to the education setting. So it may not translate specifically to a church or to a museum or to some of these other settings just because children are showing up into that location. All right. Any other questions? I'm trying to go through my email, texts. As you know, I get them many different ways throughout the week. So any other questions that people have for Lane this week? As a reminder, there are 3 new mask orders: the county, the state, the Louisville. So I sent those out. I sent out the epidemiologist webinar last week, and I just put it in the chat. We will know more in the coming week or by next week's session, hopefully, about what the change will be in the next the next order change, or that change from the state to the local. So next week's session should be hopefully enlightening. So please try to attend next week's session to understand what that change will be. In between, ask your questions. We try to get back, even when we're out, we try to get back at least with an answer or forward it to somebody that can get you an answer. Oh, will the dial remain the same throughout the summer, or could we see a change as well? You're on mute, Lane.
We are expecting a change at the end of next week. So I think, again, those Metro partners are probably going to put another interim for another month. And then after that, I'm expecting another change. So again, whether the dials are gone completely. So I think the summer, it is likely that we will not see the same level of dial requirements. And it might just be very much something around masking and trying to socially distance where possible. But I don't know if it'll still have anywhere near the same level of specificity that we have now. So, but I'm projecting that we're going to continue to step things down. We hope that by summer we see very close to the herd immunity percentages that we need, ideally getting into that 70 or even better into that 80+% of the population. So if we're there, we hopefully don't need to have as many of the other safeguards in place.
I get my first vaccine next Tuesday, so
Yay.
I'll be on the call next Thursday after being, partially vaccinated.
Yeah. So that's really the message: is get vaccinated. Tell everybody that you know to get vaccinated, because that's how we get out of this.
Get vaccinated. Let's continue to distance. Let's continue to get through this together. All right. I don't see any other questions coming in. Again, most of the links were provided in today's email. You got it this morning, but if you can't find it, just email me. Just let me know. We will see everybody next week. Hopefully we have an update of some sort about the dial. Thank you, everybody. We'll see you next week.
Thanks.
Bye.